Hi everybody, welcome to this module about styles of documentation for healthcare providers. The objectives of this module are to describe different options for client documentation, specifically progress notes, and practice documenting different types of client progress notes. I just wanted to make a note that the legal and ethical components of documentation are beyond the scope of this module, and you can refer to your regulatory bodies for more information on these topics. The purpose of documentation is to communicate information to the team. It's a legal document, and it's important to document the care provided, any changes in what you're doing for the client, and any changes in their status, and how those modifications were made, and the outcomes of those modifications. It's also important for education and research. There are a few basic guidelines. There are more, but these are a few tips. It's important to document in blue or black ink on paper charts. Date and sign all of your entries, and don't leave any blanks. Draw a single line if there is an error made and initial it, and make sure it's complete, accurate, and organized. There are different types of progress notes. A couple that we'll be talking about are problem-oriented medical records. So these are your SOAP, PI, and DAR progress notes. There's also narrative and charting by exception, to name a few. So the first type is SOAP. SOAP stands for subjective in the S, and this is what the client tells you, and you document in quotations exactly what they're reporting to you. The objective data, and this is what you observe. So these could be your vital signs, these could be the assessments that you made. And then the assessment, this is a description of what you think is happening with the client. And then the plan, what are you going to do, what interventions are you going to implement? Pie charting is similar in some aspects, except you start with the P for problem and its explanation of the client's current problem or situation, and then the intervention or the care that was provided, and then the evaluation of how those interventions worked. The next type is DAR, so D stands for data. This is objective or subjective data that you would write in this line, the combination of those two things. Then the action or intervention that you implemented and the client's response to those interventions for the R. Another type is narrative, and this is more like a story format. So you're still including all those elements of subjective and objective data and interventions, but you write it more as a story based on those assessments and their interventions and evaluation of them afterwards. Sometimes you'll see initial assessments done this way using a systems-based approach. There is also charting by exception, which is a document that documents the normal progression of that client's situation, and if there's anything abnormal or out of the ordinary, there is some way to do this in charting by exception, but you may also have to use a narrative or SOAP format to document that data along with the charting by exception. So what I want you to do for the next part is watch the following video and then practice your client documentation. So I'd like you to watch this scenario.
Mrs. Smith, are you finding it difficult to breathe right now?
It's hard to breathe.
It's really hard? Okay, I'm going to just
breathe.
lift you. I'm going to lift the head of your bed up. And that should maybe help you a little bit by just sitting up a little bit. Okay. Has it been happening for a little while now? Okay. So we'll just get you up here. Okay, and I'm going to just check your oxygen saturations. So I'm going to put this on your finger here. I'm also going to check your pulse and your respirations. Okay, so your oxygen saturation is actually quite low right now. It's 90, at 90%. Your respirations are actually at 24, and your heart rate is 98. So it's actually a little bit higher. So what I'm going to do first, Mrs. Smith, is I'm going to put some nasal prongs on you and give you a little bit of oxygen. I'm going to give you 2 liters of oxygen, and this should help you a little bit. So I'll just get this behind your ear here. Sorry. And I'm going to put the oxygen level up to 2 liters. Okay, so just try and stay calm. Okay, and actually I'm going to listen to your chest, okay? So you're able to just sit up for me a little bit more. I'll put my hand behind your back here to help you. Okay. I'm just going to go to your back here. Just take some deep breaths in and out if you can. Okay, so I can hear a lot of wheezing on both sides of your chest, and actually a little bit less air entry into the bases of your lungs at the bottom. So hopefully this oxygen is going to help you for a few minutes. Just try and take some deep breaths and get the oxygen in there. And just looking at your chart here, it says that you actually are due for your Ventolin. So we'll try some of the Ventolin. So I'm going to shake it, and then you're going to try to blow out as much as you can, and then blow in when I press the button. Okay. Okay, good, and try to hold it for 3 to 5 seconds. Okay, good. Okay, blow in. Good. Okay, so just try to hold that for about 3 seconds. Okay, so now I'm just going to check your oxygen saturation again. Good. And it's getting a little bit better. It's up to 93% now, and I'll just check your pulse. Good, and your pulse is actually, it's down a little bit. It went down to 96 beats per minute, and your respirations are down to 20 per minute. So it sounds like it's getting a little bit better. Is it a little bit easier for you right now?
Yes, it's a lot better.
Good, and I'm just going to listen to your chest one more time. Good, I'm just going to go to your back. Okay, that's good. I can hear a little bit less wheezing now. It's actually, the wheezing is getting better. Okay, so I'll just sit here with you for a few minutes. Is it feeling a little bit better?
It's better.
Good,
Thank you, yes.
good, okay.
So what I want you to do is pause the video now before moving on, and I want you to document using either SOAP, DAR, PI, or narrative format what you would do as a professional in this situation. How would you document this based on your professional role? And then what I want you to do afterwards is compare with each other what you would document in these different formats. And then you can also check, there's some slides here on afterwards that you can check to determine how you did and what may be similar or different. So you can look at the SOAP example for this situation, looking at what the client stated, what the professional did as far as an assessment, and what their plan was. And then you can also refer to the PI documentation, the DAR, and the narrative documentation, and look at all of those. So thank you for your time with this today. I hope you found it helpful and give you some tips with client documentation in this type of situation.